Hi, I'm Kelly.
And I'm Amanda.
We're going to be doing a nurse-patient interaction about the education of 4 antipsychotic medications. So, here we go.
Hi Kelly, my name's Amanda and I'm going to be your student nurse today. Can you tell me your name and date of birth?
Kelly Drake, 7/29/97. Can you tell me why I'm feeling like this? Like, how are you going to help me?
Yeah, so I definitely want to help you as best as I can. So you've been taking Seroquel for your schizophrenia and psychosis symptoms, but it doesn't seem like that's been working like it should.
What do you mean it's not working the way it used to?
So from like the information we've gathered, it seems like you probably took a time off from taking that medication, and so when you do that, it can kind of not work as well as it's supposed to.
Okay.
But we talked with the provider, and we're going to switch you to clozapine, which is a very similar med to Seroquel. So what we're going to do is we're going to start tapering you off of the Seroquel to switch you to the clozapine.
Okay.
To continue helping with those psychosis symptoms.
Okay.
So let's talk about these meds.
Okay, what do I need to know about them?
So with Seroquel, there's a very common side effect called metabolic syndrome, and it can cause like increased weight gain, increased blood sugars, and an increase in your triglycerides and your cholesterol. So to monitor that, we're going to get a lipid panel, and we're going to make sure you come in for regular scheduled blood tests to keep an eye on that.
So what can I do to prevent these side effects of this medication?
That's a great question. So with the blood sugars that I mentioned, you want to keep an eye on those, and you can check those at home. And with the increased weight gain, you can eat a regular, healthy, well-balanced diet. You can also exercise, and to keep an eye on like making sure that's all good, I recommend that you get a scale so that you can weigh yourself at home. And it's best to weigh yourself in the morning before you eat, at least at the same time every day. But that's the best time because you haven't gotten any food in yet, so it's like a normal weight. And we're going to give you a 50 milligram pill of this. So basically everything I just told you, that was about the Seroquel, which we're going to be tapering you off of with the clozapine.
Okay, and what do I need to know about that?
So with the clozapine, we're going to be giving you a 12.5 milligram once a day. But it's going to take a few weeks to start taking therapeutic effect. But it is very similar to the Seroquel. It has very similar therapeutic effects. But while we're waiting for it to take its full effect, we're going to try and implement some non-medication techniques, and some of those are breathing techniques, aroma art therapy, cognitive behavioral therapy, exercise, as I mentioned earlier, various support groups, and like creating a structure in your life.
Those sound interesting. What are the side effects about this medication?
So you want to look out for fainting, heart palpitations, which will feel like a little flutter in your chest, and especially weight gain and neutropenia.
What's neutropenia?
Neutropenia is a low white blood cell count, so that means you're at a greater risk for infection. So with like the lipid panel, we're going to have you do blood tests to make sure that your neutrophil count is okay. But we also want you to be aware of like signs and symptoms of infection, so like fever, chills, things like that. Just that you can make us aware of those if they start to occur.
Okay.
So also with that blood test, we're going to be looking at trough levels of the medication, which is basically how much med is in your system. So we're going to make sure that it's an effective level, but also not a toxic level.
Okay.
So your doctor has also prescribed you a 2 milligram pill called Cogentin, because while we're waiting for the other antipsychotic medications to take effect, we're going to use a backup PRN medication called Haldol. And Cogentin is used to treat some of the side effects of Haldol.
Can you tell me what the side effects of Haldol are?
Yeah, so there's EPS symptoms, which are extrapyramidal symptoms, and they're going to present as like involuntary muscle spasms or jerks. These are most commonly like found in the tongue. So if your tongue starts moving around all weird in your mouth without you doing it on purpose, that's an EPS symptom. It could also be like rigid muscle movement, like shuffling gait, restlessness, things like that. So that's something you want to be aware of. There's also a QT prolongation, which has to do with your heart rhythm. And so if you start feeling like weird heart palpitations, like I mentioned earlier, a flutter in your chest, you want to make us aware of that. And we're also going to get a baseline EKG to find out what your normal heart rhythm is, so we can monitor if that changes. There's also something called agranulocytosis, which, as I mentioned earlier, puts you at a greater risk for infection. So we're going to get a CBC with a differential, which is a blood test, to look at your neutrophils to make sure that those aren't going up, which would indicate an infection. So another side effect is neuroleptic malignant syndrome, which presents as an altered mental status, rigid muscles, like I mentioned before, a high fever, high blood pressures, and sweating. And so since we covered that, now we're going to talk about some of the side effects of cogentin.
Okay.
So something that a lot of patients usually have difficulty with on this medication is a dry mouth, which you can either use some chapstick or chew gum for. And then another more serious side effect is something we call anticholinergic crisis, which presents as difficulty sweating, dry skin, the dry mouth, dried out eyes, and also really high fever, so you'll be hot, and then also like confusion. And so if you experience any of these, we want you to let us know like as soon as possible.
Okay.
It's also important that with all of these medications, you be careful with certain activities that could lead to an increased core body temperature. So like strenuous exercise, dehydration, and being in extreme heat.
Okay. Well, I like to run and ride my bike to help relieve stress. How does this impact that?
So it's actually great that you mentioned those, because also with these medications, you want to be careful doing certain activities that require a lot of alertness until we see how you're going to react to these medications.
Okay.
And so in terms of like reducing that stress, we can incorporate some of those non-medication techniques that we talked about earlier.
Okay. I could definitely see myself being interested in some of those. And then I know you mentioned that I should incorporate some like lifestyle changes or a structured lifestyle. How can I do that?
Yep. So you could write out a schedule for your days, and you can have something that you incorporate on a daily basis to develop some consistency and balance. And so in terms of exercise, if that's something that helps you relieve stress, but we want to avoid some more of the more strenuous activities, you could do something like yoga. Yeah.
That makes sense.
Okay, and so I know I just gave you a lot of information, so I will like get that printed out for you so that you can take it home and use that as a reference so that you can be better prepared to really keep up with this medication regimen this time. And then I will also be back later so we can develop a wrap plan for you that will just help you to be even more prepared.
Great. Thank you so much.
You're so welcome.